I'll call the Public Health and Safety Committee for Monday, March 18th, 2024 to order. The first order of business is to approve the minutes of our previous meeting from 1/22/04, copies of which are in the packets. Did anyone note any revisions that they need for the minutes? If not, I'll take a motion to approve the minutes. Motion from Larson, is there a second? Second from Denny. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye. Opposed? None are opposed. That motion carries. Minutes are approved. Item 2 is to consider approval or denial of various license applications. You have the batch for this month in your packets. Go ahead.
I just have a question about the minutes. Were they from February 19th or 1/22?
The agenda says 1/22. Let me just check. Hold on. So is the agenda wrong? Well, the minutes are. Let's go to the packet. Okay, so we'll correct the record. The minutes in the packet that were approved are the minutes from 2/19 of '24. The 1/22 minutes have been previously approved at the February meeting. And the minutes that were in the packet are the February meeting minutes from our last session. Item number 2 is to consider approval or denial of various license applications. We do have the batch in front of us for this month. We do have 2 recommended for denial. The first one comes to us on a refer back from Common Council, Kenneth Lashuk. We had asked council if they wanted to refer him back to us for reconsideration to allow him time to submit evidence of rehabilitation. Upon review of the Assistant City Attorney, it appears that the violation to which Mr. Lashuk was convicted is an exempt offense. That does allow for recommended denial of the license without regard for evidence of rehabilitation if the activity is substantially related to the license for which he's applying. However, if Mr. Lashuk is with us and he wishes to offer information, I don't believe evidence of rehabilitation was received between the council meeting and tonight. Is that correct?
Yeah.
We've not received any paperwork. Kenneth, is Kenneth Lashuk in the audience tonight? If you'd like to come up to the podium. Welcome.
Thank you again.
Yep.
I'm just waiting back to hear from, the reason why you guys haven't got anything, because I'm waiting to hear back from the institutions about, because I submitted requests to get my rehabilitation records and everything.
Okay.
Because I called probation and parole and they pointed me in the direction of contacting the prison system.
Okay.
So I'm just waiting on that, and I do have one letter of recommendation that I just received over the weekend.
Okay. So you would be allowed to submit that. Obviously, the police department needs time to review that along
Yep.
with your other information. So I guess my recommendation would be, if the committee is amenable to that, is that we would hold action on this particular license until the April meeting. That gives him time to turn documents in, and then it gives time for review. So, Doug?
Yeah, it would be good with that. Is there a fee associated with it so that he's not losing his money yet?
Well, the application fee, but we haven't
So we
acted
haven't
on the license
adjudicated.
yet,
Okay.
so he's
All
not
right.
reapplying.
Okay.
Okay, so yeah, if you need that extra time, we can hold action on it for tonight. Just gather your things. You'll need to have it in, though, by the 3rd Monday of April.
Okay.
That's when this committee meets again.
Yep, because as soon as I get it back, I will come in and drop it off for Cody.
Okay, that's fine. Sounds great. So yeah, we'll hold action then on yours. The other applicant that is recommended for denial is John Wallen. Is John Wallen in the audience this evening? Let the record show he has not appeared. Then also in the batch for this cycle is special event permits for Wausau Night Market, for Holy Names Summer Fun 2024 event, for Pride Fest, Class 2 event for Armed Forces Day, and then a few picnic licenses for some spring and summer events. With that, I would accept a motion to approve or deny licenses as recommended by staff with the exception of Kenneth LaShook, if someone would like to make that motion.
Move to approve as listed.
Okay, we have a motion from Denny. Is there a second?
I'll second.
Second from Hanky. Further discussion? Seeing none, members in favor signify by saying aye.
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 Opposed? None are opposed. That motion carries. Item 3 is discussion and possible action on an agreement for urban search and rescue emergency response services with the state of Wisconsin for Wausau Fire. You have a copy of that agreement in your packets. Tegan has actually reviewed that contract and has not noted anything of concern. This is a renewal of this agreement, I believe, right, with Wisconsin Emergency Management? So periodically, this one comes to us to continue those collaborations. Does anyone have any questions on that contract, either for Tegan or for the fire chief? If not, I would take a motion to approve that agreement. Motion from McElhaney, is there a second? Second from Hanky. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye, opposed? None are opposed, that item carries. Item number 4 is discussion and possible action on the community care paramedic position for Wausau Fire. You'll recall, and I want to say it's probably been almost a year ago, Chief Bartek came to us first with the concept of a community care paramedic. And that actually came out of a committee of the whole discussion that we had early in our terms with some things that we could look at for a couple of things. First, the community care paramedic program has the effect of reducing potentially emergency ambulance runs and rehospitalizations for people with certain chronic conditions. I believe that at first when Chief Bartek was talking to us about community care paramedic, there was also some value to having that position within the fire department with our community outreach work that's already happening with our unhoused population. So we actually could see a two-pronged benefit there. We'll bring up Chief Kopp, though, to give us an update on that process. I know when we left the conversation with Chief Bartek, we knew we wanted to know more, but we also wanted to know if there were partnerships available in the community to help us. So welcome.
Thank you. Appreciate this opportunity. So this would, like Alder Asmussen said, this has been in the works for a while. We've ironed out a few details and come a long way. And what I submitted into your packets was a couple of PowerPoints as well as a white paper. So I'll try not to read everything back to you and go through it all, but I'll be willing to answer some questions. What I think I'll do is I'll just go through the PowerPoint, the Wausau Fire Department one, and hit a few key notes and then go into questions and answers, and we can get as in-depth as we need to going into the white paper if you got any questions on that.
Okay. Do we need that PowerPoint up on the screen so that we can have it for the public as well? And then that then can also go out on public access for those that are viewing outside? We'll just give that a second to load. It isn't super long, but I think there's value in
For sure. Well,
being able to see that presentation.
while it's loading, the idea behind this is it's for the fire department along with our stakeholders and our community partners is to, try to think outside the box in order to work collaboratively and to help our citizens in the most efficient way possible to keep them safe and to make sure that we're helping our healthcare needs as much as we possibly can. We have so many challenges with it. So I think in the packet it talked about our partners being Aspirus, Marathon County Health Department, Wausau Police Department. When we gave this presentation to the HR committee, all four of us were up here and talked about some things. I think I can just go through it and button it up. But Chief Barnes and Deputy Chief Plus are here also, so we have plenty of people to answer questions that you might have. Getting into the first slide, you'll see that we listed some our objectives, and our objectives are to improve the overall health of the Wausau community, reduce the use of ambulances as the first access point to healthcare. What we're talking about there is, you know, a lot of times we have high utilizers with our ambulance service because they don't know what resources are out there. They're not sure what to use or who to call. And a lot of times that ends up just being the 911 system, and they end up going to the hospital many times per day, sometimes per month. I did look up our 10 highest utilizers for a 6-month period, and I believe it was 320 230 transports over 6 months, meaning that over 400 times a year, we're taking the same 10 people in the city of Wausau to the hospital. Where if we had a community care paramedic, we'd be able to help them in home, make sure we take care of whatever they need to be. Maybe they're not understanding their meds. Maybe they're not understanding what resource they need to see. Maybe we could help them schedule an appointment with a specialist. So that's kind of what we're talking about there with reducing the use of the ambulance as a first access point when it's not needed, and reducing the wait times in the ER along with it. So then that was the third bullet point, was the emergency room usage. Reduce readmissions of patients to hospitals for the same diagnosis. Build a relationship with other healthcare resources within the community, and assist the community outreach coordinator with access to healthcare for clients. We all know how busy Tracy is. I believe she's right behind me here.
She is.
But, you know, with any resource, we could team up, and we'd find that it might be a great partnership also to help with different health needs that are out in our community, not necessarily in homes, but also in the unsheltered area. So we added that part in there. When I talk about building relationships, a lot of times we're tasked with transporting people to the hospital and hoping to get to the right place and things like that. But for an example, like maybe we have a young mother who doesn't know who to call or where to go, the community care paramedic could help her through that process. That's just an example that popped into my head just now, so I'm using it. But you know, there's so many different things that this community care paramedic could do and help with that the use of 911 and the ER are not viable options sometimes for these people, and they can learn all the different ways and using different tools. Moving on to the next slide. Community emergency medical services work collaboratively with stakeholders. I talked about that a little bit. And this whole thing is just talking about the different ideas and different things behind it. In many communities, they're using this sort of statement because of the fact that it's working out so well. City of Madison has 10 of them, for example, and it's growing and becoming a more important piece of the healthcare system as well as the 911 system. So we'll pass over the Madison Department, Greenfield. There's just a couple examples. There's a lot more departments out there that are using this idea. I talk about in the next slide the referral process. I think with Chief Bartek, a lot of it was the referral from the hospital, and we would take those referrals via fax from Aspirus and from other hospitals, and then we would go to the house. And what we would do is just do a home check and try to cut down on the readmissions to the or to the hospital. What we're looking here now is to get into the homes and do checks, safety checks, as well as referrals, but referrals back the other way too, which I just spent quite a bit of time talking about. But not just referrals coming to us, but referrals coming in and referrals going out to the appropriate people and specialists. Some of those diagnoses that we would be referred to or we get referrals for would be COPD, CHF, pneumonia, diabetes, stroke, and homeless. Some of the tools that we figure we would need for this would be to be able to do food security assessments. So this community care paramedic would be able to help our patients in their homes with knowing what they need for food and what's going to keep them healthier and keep them on their diet that they might be prescribed by a nurse or a doctor. We want to do in-house trip and fall hazard assessments. So basically we'd be checking to see, well, I should start with telling you all that nationwide trips and falls are our leading killers among our populations throughout the nation, as well as injuries and transports to hospitals. And if we can get in the homes and educate people just like we do with fire prevention, we'd be able to cut down on this significantly to make sure that throw rugs or trip hazards or unnecessary hazards and stairwells and things like that are taken care of so that we're not transporting for what is the most common use of 911 at the moment. referrals to the ADRC, fire and life safety assessment, prescription drug assessments. One of the biggest challenges we see are people not understanding what drugs they need to be taken once they get out of the hospital and they had their prescriptions filled, and this person would also help with that. So
So as you're switching slides there, when we first talked about, we tried under Chief Kujawa, we tried just a trial of this in partnership with Aspirus, with the medical director at the ER. And so in that pilot program, I believe the hospital picked the patients for the trial, people that they knew were frequently readmitted that had the conditions that you had listed. And I think that they were convinced that they had some success with that trial group, but we just didn't have the resources to pull it together long-term. So we sat for a little bit and then then tasked Chief Bartek with going out to figure out how to revive this, knowing we had some decent results. But this then, and I think now with what I see here, seems to be of significant value to our senior community with the trip and fall type stuff and that, right? Is that kind of where?
yeah, I think we've expanded it enough to know what we've learned from that pilot program, which, to be honest, wasn't very successful for us. It was that we need to be doing more than just showing up on a referral and say COPD, for example, and just following up on one thing and having that tunnel vision, so to speak, and just taking care of that patient that way. This part goes all the way into, taking care of everything from falls to medications to food to living conditions and all that, all bundled into one, and this person would be trained for that. And I think a great example of that would be like Deputy Chief Plus used the example once was, in the 70s we had an issue with fires, right? So nationwide we took on this initiative to go into fire prevention and add fire inspectors and do all these things. Well, I think what we're seeing is in the EMS world, the same thing is happening. And we need to be able to adapt to it, change to it, and get ahead of it so that we can handle the problem at hand. And just like fire prevention and just like taking care of our fires, now we're being proactive and getting in front of the EMS challenge, and that would be by using a community care paramedic and taking care of them inside their own homes and taking care of their homes and all the hazards that come with healthcare. So
Okay.
thanks for bringing that up.
Well, in
But
theory,
it's,
that should allow that person to age in place way more successfully though, right? I mean, as far as.
Agreed.
Okay.
Yep, for sure. On the next slide, we just talked again about the community care paramedic working with the outreach coordinator, building relationships with public health, North Central Healthcare, and other healthcare assets in the community to reduce the ambulance calls and emergency department visits. I talked about that. I got a little ahead of myself. Some of the ideas behind this position would be it's a pilot program. The paramedic, it's a 3-year pilot program. Right now, I just got confirmation from Aspirus that they agreed for the first 3 years to fund 40% of this position if we were to move forward with it. So we just got that confirmation today, and we're waiting on confirmation from the Alexander Foundation for another 40% covered for the first 3 years to show how successful this can be, and I have no doubt in my mind that after 3 years, we can definitely show how successful we were, and we might even be talking about more positions in this realm and being able, there's language and legislation already talking about being able to bill Medicare and Medicaid for these patients and making home visits rather than just being able to bill for 911 visits. We're looking for this paramedic to have 3 years of experience, a background in community care medicine, a relationship builder, and works well independently, much like the PD has with Tracy. Equipped with a cardiac monitor and proper evaluation tools, and dedicated department labeled vehicle. Those are all things as far as those tools go, or one more part that we asked the Alexander Foundation to fund. I already talked about the 3-year trial on this next slide. I think it's important to talk about the quarterly and annual progress reports. Part of the reason I think that we were unsuccessful with the pilot program is we weren't very good at tracking, and we didn't spend a lot of time in tracking where we were progress-wise and taking care of all the data that needed to be collected. I think you can only learn and get better by doing that and starting in small increments, setting goals and meeting those goals in a quarterly fashion and making sure that we build upon instead of putting it all on the front end, and build on it going into the back end and making sure that we can keep moving forward and keep doing what we can for the best of our community. I've already sat down with the chiefs of Safer and Riverside and told them what we were hoping to do here, and, they're keeping a close eye on it, would like to become a partner in it, possibly in the future also. And it could definitely turn into something that would be, countywide. The next slide was about numbers. The first one of the 192,000, that's your first year. That's because of the equipment and the training that we would need to do. And then the additional years is on the right side for $130,000, basically the wage and benefit package for one employee per year. So that's what we're looking at for costs and numbers, roughly.
So for alternative funding, you're looking at 80% of those numbers, correct?
80% of those numbers, 20% from the city would
City
be the
share.
ask right now.
Okay.
But that does not mean that we're going to stop looking for funding. Deputy Chief and myself are looking every day at other types of funding. We actually have a meeting with NTC tomorrow. We met with, Tammy Baldwin's office this morning, and we're going to continue to keep looking for different ways to fund and maybe cover the rest of that 20%.
Sure.
So,
Okay.
or even for years after the 3 years. The next slide just has a list of things. I can skip over that because I don't think you guys need me to read that stuff to you, and we kind of covered it all already. And from there, I would take any questions and answers, or if you want to go over the white paper, I have no issue with that either.
Does anybody have questions for Chief Cobb? Go ahead, Doug.
Thank you, Chief. So help me understand the referral process. So we're trying to eliminate some 911 calls. So will we be triaging these or evaluating them at the time of a 911 call, or will it always come from Aspirus or from another referral?
No, and that's a great question. I'm glad you asked that. That's one of those things where I think the referrals could come from anywhere. They could come from the hospital. They could come from our paramedics that were on scene and maybe didn't transport someone or did transport someone and refer that patient to our community care paramedic for future evaluations, as well as just coming from the healthcare center or any of our other stakeholders or community partners throughout. So it would be just a referral process that would be along the lines of a phone call or an email or something like that is how I vision it right now, but not necessarily just from the hospital.
So if we already know who 10 of the 233 ambulance rides are, that pool could potentially be first-time referrals here?
Yeah, I would definitely talk about that being one of our first objectives for the first quarter is working on our utilizers that use that many 911 transports and see if we can definitely cut down on that usage. So I think that would be one of the first goals for us in the first quarter.
Okay. Anyone else have questions for Chief Cobb? I know that when we first talked about this, we liked the concept, but we wanted to know more. And I think now, given this extra information, where we're heading is I think that their ask of us as public health and safety is if we're still interested in it, we want to pursue it. The next step, I think, would be to ask finance to accept the funding that's been gathered and then seek to find the local share, either within or from outside. Chad, go ahead.
Thank you. So you mentioned Aspirus already and foundations. Have you gone to the county yet?
Yeah, and
Okay.
not so successful there, but we have talked about it.
I had to ask.
And hopefully in the future, once we prove some of the successes, maybe that's another one that opens up. And I think a lot of funding will open up for us once we prove and show the data and how much of a difference we make with this position.
I know you don't like giving up people, but could you ever see a scenario where this person's eliminating so many EMS runs where, maybe we don't have to staff up as much, just in my mind, just some more cost savings that could come from it.
That would be a great thing to free up our ambulance, but as you all know, our ambulance calls go up every year. It's going to be no problem for us to break 7,000 runs this year. It's gone up every year since I've been here, other than maybe one, but that was a while back. So, when we're talking about, we'll alleviate a lot of runs, but they're unnecessary runs and things like that. But on the back end, we're still going to be gaining runs in another realm, right? And having our ambulances available for emergencies that are happening for a first time for someone, and being able to help someone is key, so.
Sure, true emergencies, really.
Yeah, and, we do have our share of mutual aid coming in to handle our ambulance calls when all three are out at one time. And hopefully we can alleviate that problem also.
Sure. And so I guess coming from public health and safety, I mean, I think this is a good idea, and yeah, I support sending it to finance, so,
Thank you.
yeah.
Sounds
Thanks.
good. Any additional questions or comments? And I believe has this position already been discussed in this program's been discussed in HR, right? And I think that committee was also supportive? It seemed to be, okay. So then the next logical step then would be for us to send a recommendation to finance to look into the funding of the local share and the acceptance then of the two supportive funding mechanisms. Does anyone want to make a motion to forward this to finance with a recommendation to locate funds?
I'll make that motion.
Motion from Larson. Is there a second? Second by Denny. Further discussion? Seeing none, members in favor signify by saying aye.
Aye.
Aye. Opposed? None are opposed. So that motion carries. We'll take that on the, hopefully on the next finance agenda, which should be next Tuesday. If we've got agenda space, we could take it right away then. And if we find that in terms of materials or confirmations that we're not quite ready, we could always wait a couple weeks. But if it's ready for next Tuesday, I'd be happy to put it on
Thank
for
you.
that. So,
Appreciate
all right,
it.
thank you for that. That brings us to item number 5, discussion and possible action on approving the addition of 2 officers to the Wausau Police Department's authorized staffing level. And we've got a request from Wausau PD, but this one has actually, it's almost more like, it seems to me like more like advanced hiring, much like what we do in the realm of succession planning, where we kind of have some overlap for a period of time for a specific purpose, I guess, is kind of how I read this. I'm going to turn it over to Chief Barnes to
Sure,
talk to us about this.
This is the first committee this request is in front of. President of the council and Chair of HR, McElhaney, and myself had a discussion, and we felt that having this conversation, given that the unhoused community and the challenges with it are discussed on a monthly basis here, to come through this committee first. There is some exigency to this request, and it's not something I wanted to make to the council at all. The process we normally follow in seeking additional positions is to use our budget process and go through, well, you're all part of that process. But when that budget process was occurring, I didn't have the same concerns that I have now. The concerns I have now that have brought us to the point of asking for additional officers are relatively new, and they're exigent. So the unhoused population in Wausau has grown significantly in the last 3 months. That's based on data from our service providers as well as our officers. The concerning component of that is where those individuals are reporting that they're from. They're migrating into Wausau. A significant portion, if not the majority of those individuals, are not entering homelessness as a Wausau resident or even a Marathon County resident. They are coming here with no ties to this community by their own acknowledgement and admission. And they bring with them some challenges that we have not dealt with here, as well as many of those individuals that have been unhoused in our community for some time are reporting to us not feeling safe as they would have felt before, given their interactions with many of the newcomers to our community. So when we see Catholic Charities reporting to us in a 2-month period of time, seeing 100 new individuals that were unknown to them, that are unduplicated, that brings significant concern to the police department. And then internally, what we have had to do is allocate a significant amount of our resources to our downtown area, responding to the behaviors of that population, that population within this city. So I could sit here and play videos from our parking ramps, body cam footage. It would shock the conscience of anybody watching to see those behaviors that are occurring in our downtown. I'm more than happy to invite any elected official to our office where you can spend hours watching that. What I do know is it is lowering the value of our community. It is It concerns me about our ability to develop our downtown economically. It concerns me what the future looks like if we don't do something about this and do something about it right now. Our downtown, through my lenses, is the core to our community. We need a vibrant, thriving downtown. There's a ton of development that is in the works. As I sit through council meetings, listening to the mall development, I look at some things that are already in place down there with the Children's Imaginarium. We just heard a presentation from them. But they're also reaching out to us with the concerns that are impacting their ability to exist down there and feel safe and have an area that they're bringing children. We get calls on a regular basis from the library. We're trying to staff officers doing walkthroughs through the library every afternoon. So what I'm actually seeing from our department is a reduction in services to the rest of the city from our patrol because we have to take so much of our resource and invest it in our downtown area. And that's 24 hours a day. So it strikes me that it's not appropriate for those individuals that pay rent and pay taxes and own homes in our community to get less police services as we invest a significant amount of our time and resources downtown. So this concerns me to the level that we looked at other programs we've done historically that have proven to be successful. And two of them that I'll highlight are our CART program, which I think most of you are aware of, our Crisis Assessment Response Team. And that's where we partner a law enforcement professional with a crisis professional. And they go out and do their work together. But I also look at our CROW team, our Community Resource Unit, where we found that if we can take officers who get to spend all of their time focused on a singular issue, they're way more successful than our officers that are trying to fit in, checking on different areas throughout our city, in between other calls for service that they're being called to. And so that's the impetus for this request. We need officers and a team of officers that collaborate and balance with the work that Tracy Rieger does. She is getting people to resources. So will these officers, and they will work with her. That will be a primary function. But they will also be expected to hold everyone in our downtown accountable to the same standards, to the same laws, to the same ordinances, and to the same quality of life that we expect in Wausau. And we're just not able to do that right now as effectively as I believe we need to. So one of the things when people ask me about what's my thoughts on the homeless or unhoused situation in Wausau is, I just don't believe the ship has left the dock yet. I think the ship is parked there, it's being fueled, it's being loaded with supplies, and it's about to leave. And if we let that ship leave and we haven't made a positive impact on this, 5 years from now, it's going to take so much more to positively impact change and get these issues under control in our community. And I think now is the time to do that. And that's the justification for going outside the normal process for asking for additional officers or to expand the FTEs and approve staffing for the police department. I think it's also important when we think about the unhoused population in Wausau to understand that this is not going to solve homelessness. There are other community partners that need to be involved. There is leadership from this council and from the city that can be done with policies, with encouraging appropriate resources be in place to be able to make a positive difference. And there's going to be some really hard challenges as the resources that are here are not robust enough to serve an ever-growing population of unhoused. So then the challenge comes, who wants to pay for the additional resources? And or we watch what I think is starting to occur, where we water down the effectiveness of our resources. They're finite. There's only so many beds in shelter. And as the population of individuals needing shelter goes up in our community, as we have a migration into our community of homelessness, there's just not enough. It mitigates the effectiveness. If we want to be able to house people in shelter every day and they're only getting in 3 days a week, that's mitigating that resource. And I think we're seeing that across the board. And those service providers that are having daily contact, whether it be the Salvation Army or Catholic Charities, are the ones we rely on to give us some information about who they're seeing and what they're seeing. And our officers reporting to me on a daily basis, meeting new people who they've never interacted with before, whose behavior is not appropriate in our community. And they just moved here. And from areas with quite the distance, and we're not talking about neighboring communities or other communities inside Marathon County. And I start to think if we can get individuals working toward leaving homelessness in this community that are from here, that should be a priority for us, is serving them, and I think that's a manageable population. The philosophy that's really stuck in my head as far as resources is we should be doing everything in our power to have robust resources that are funded, that empower people to leave homelessness, but resources in our community that enable people to live here in homelessness are just not appropriate. And as we see communities around the country that have made positive strides in addressing homelessness, that is a philosophy that they share. They also utilize their law enforcement services to hold a very high standard and hold everyone to that same standard in their community. And those individuals that don't want to live by those standards leave, and they look for a community that might be more tolerant of their behaviors or their lifestyle. And maybe that's a good thing. The research that we've looked at, and that's federal research, says individuals are much more likely, statistically more likely, to achieve success in addressing addiction issues, mental health issues, and leaving homelessness if they're doing it in a community that they have ties to. And those ties can be it's someplace they grew up, it's someplace they were a resident of at some point, or that have supportive systems for them individually. That makes sense to me. And so finding ways to meet everyone's needs, but focus on our residents, I think that's manageable. And if we can get to a manageable population, we can get better outcomes for them. And part of that is still having a thriving community to protect. And if we don't start, if I don't have the staff to be able to do that, to be effective, I'm just terrified at what the future looks like.
Thank you for that. I think that as we have kind of tried to step our way through some of this, back to even when we proposed the outreach coordinator, when we stood up the year-round night shelter, when we helped with ARPA funds to stand up the day center, keep that going and get it open again. I think we always have recognized, especially within our task force that has been working on this issue for a few years, has recognized that the solutions, there's no magic bullet, but the solutions really are a combination of both accountability and help. And so we always have, I think, been good about acknowledging that we want people to get from here to here, or at least on a path to a more positive place, and not continue to dwell in a state of continuous misery or inebriation, which is a lot of the trouble that we've had in the past, where prolonging that misery or that state isn't helpful. But if we can get to a point, either through our outreach and through our collaborative effort, like you mentioned, the CART unit, I think to get people on a positive path and on a path forward, not to say that it's not a very difficult path to follow, I think that, our success will be that much better. We've continued to send Tracy Rieger out to, work to house people, but part of our talk in this committee and at council has been people do have to be housing ready, and they have to be in a mindset or in a state where they can make that progress. They're like physically capable of making that progress also, so that she can have sustained results, not just measurable results, but to make sure that the people that she puts on a forward path can continue on a forward path and not stagnate, in that state of mere existence. So your request certainly makes sense. I think that, in our discussion in the lead up to this, you had mentioned that you were looking at working on some fund sources that are not just, they're not just levy and ARPA. There's other sources, but I know that you'll need some time to flesh that out.
Yeah, it would be premature, as no commitments no firm commitments have been made, but we are seeking, I mean, the likely request at some point would be to utilize some of the remaining ARPA dollars to cover the cost for the remainder of 2024, but to find a full funding source for 2025, so it wouldn't hit the levy in 2025, and then measure the effectiveness at budget time in 2025, and continue to have conversations with those external foundation funding sources. And if it's effective, then continue to move forward, and if it's not, we have the ability to use attrition and retirements to absorb those positions back into our department.
So then the request really, I mean, at least for a short time, somewhere just likely in the vicinity of 18 months, we're looking at the fact that the addition of these two positions would likely put you over your core staff allotment during that time. But once we measure its effectiveness, if our path is to continue, you're saying that you would absorb that overage then through attrition and not then add two additional permanent positions to the roster and then fill the vacancies, or?
I think we're saying the same thing in
Okay.
so much as our current approved staffing is 79 sworn positions at the Wausau Police Department. I would be asking to go to 81 through the conclusion of 2025, at which point we'd come back to the council and the committees and evaluate effectiveness and make a decision on whether we want to extend that for additional years or whether the council believes it was not effective and we want to go back down to 79. We would use anticipated retirements to be able to do that. So maybe the way to phrase it is a temporary approval of two additional sworn positions within the police department with a sunset of December 31st, 2025. But we would be moving forward with measurable assessments of the success at that point.
But the goal is that these positions that we would add would be trained and functional as patrol officers, right? They'd be assigned to this unit, but they would also have the ability to function in patrol if necessary.
Correct.
Okay.
So the likelihood is there's the potential within our community to hire from outside fully trained officers that would need a very brief field training program just to become accustomed to our ways to do things, that would have some expertise in this area. And if we're able to do that very rapidly, that will improve our likelihood of success. The alternative is we will be using seasoned officers for this team and then backfilling with hiring new
Sure.
officers and putting them through our field training program, and they would be the patrol officers.
Okay. And so this really seems to have, I think, two paths forward. If we're interested in it from our lens of public health and safety, if we're interested in this, I feel like it's got two paths to follow. First, HR. I think that, we know that we'd have to get to that committee and get their insight. You'd have to work with the HR director to flesh this out. And then, obviously, the funding arm comes through finance. That ARPA request would come into a finance meeting. It would be ranked and scored and then decided upon at a future meeting, just like we use the score matrix for any other ARPA request, if that's the fund source that's to be used for the rest of this year anyway. We'd have those future discussions, and ultimately, the council would have to make the final decision. Committee members, do you have questions for the chief at all?
I do, yes.
Go ahead, Lou.
Chief, are you getting any help from the sheriff's department at all on this?
I mean, do we get sheriff's deputies if we have a mutual aid request because there's too many things going on at once? They may be helping us with other calls. We generally don't have them helping us with the issues we're dealing with when we get called to an issue in our parks or in our downtown or in the parking ramps. However, they will play a significant role in the county covers the cost of the jail. And so just this weekend, 4 individuals, we arrested 4 people in the Jefferson Street parking ramp this weekend for violations ranging from disorderly conduct to public sexual activity to defacing our cameras and complete disregard for any direction from the officers. So what Sheriff Billup has been is 100% supportive and understands the need that we're going to be putting people in the jail, and it's not just putting people in jail, it's when they're in jail. Yes, that keeps them from reoffending or going out and demonstrating those same behaviors, but while they're in jail, we have access to them to be able to start the process of AODA assistance, mental health care, making sure they're medicated appropriately. So I see upside to that, and the Sheriff's Department is a great partner with us on that front, and we've met several times to look at what that would look like.
And my other question would be, do you see, if we grant these two positions, you see, as this as a cure-all? I mean, let me rephrase that. Would you have to come back in another 2 years or another year and say, I'm going to need 2 more officers? Or I guess that's kind of, I guess, I feel bad. I wish there was a magic answer for all this that's going on. You know, we as a committee have dropped, in the last 2 years I've been on this committee, we spent countless of dollars, and we've made leaps and bounds from what we have in the previous. But that being said, at the same time, I feel like we're feeding an insatiable monster.
Mm-hmm.
You know, and where does it end? I mean, and I'm sympathetic towards you because, you know, you're at the police and the community, but you know, when you keep asking the taxpayers for money, it's a no-win situation on either end, and I guess I'll just end my conversation.
Yeah,
with
it is.
that.
It is. It does have, I think, dual effects. I think that, you know, when the community, before we started to pour all that money into the cause of trying to address the situation and form the task force, I think that there was different issues. I think that at that point, taxpayers were frustrated with things that they were witnessing downtown, things that they were seeing, behaviors they were seeing, frustration that people weren't getting help, weren't getting connected with services. So, you know, we crossed that hurdle, and now, you know, in some ways, that help has worked well enough that it has attracted some attention, you know, but I also think, and, you know, I don't know that we can get ahead of it if we don't have
Right.
a push, right? Like he said, if the ship leaves, we're going to need way more. I feel like if we wait too long to get ahead of the problem, it will only grow.
And I agree with you, but
Yeah.
it's like I said, it's like an insatiable monster. We need to do something, but where does it end, you know?
Yeah. No, I share your same concern.
So I
Doug, did
think-
you have a comment?
I think
Oh, go ahead.
just to your question, you were like, am I coming back in 2 years and asking for more officers? And I can't look you in the eye, Lou, and tell you I know exactly what that answer is. But one of the goals of this program, and so it would be proving that this is not a successful strategy in some light, because we're hoping to mitigate and have a more manageable population. And some of that is just by holding everyone to a standard. And if we're holding people to the standard of behavior, some people are going to say, well, that's not the greatest place to be. And I will tell you that when we queued up our community resource unit, where we added an additional 5 police officers to investigating drug use and doing interdiction within our community, we would hear from those people in that, you know, that are using drugs and that are dealing drugs. They're like, well, we don't want to come through Wausau. And we would try and set up undercover drug deals with individuals, and they would set the location for where we would go buy drugs from them outside the city of Wausau, because they didn't want to be here if they were going to be held to the standards of our community. And I take that same model, and so success for me won't be coming back asking for additional staff, but I can't read the crystal ball to know what's happening. If you look at national models, we should expect our unhoused population to double in the next 5 years. But when I see in a 2.5-month period of time, 100 new individuals in our community. We're doubling a lot faster than that, and something has to be done right now, and this is within our control, how to address the symptom, because nothing I'm bringing forward here solves homelessness. Those things are outside my control, and all we can do is advocate on behalf of appropriate resources, which you've seen me come before you and do, and say, here's the gap, here's how we can help people help themselves. It's very expensive, it's very complicated, and no one will be a bigger advocate than the police department and myself for resources that allow people to leave homelessness.
Right. I think that was evident with the presentation that we had a few weeks ago from CW Solutions. I mean, just looking for different and better ways to serve that population as well. I think that every month we hear from Tracy similar concerns. Doug, you had a comment or question?
Well, I do have a question. When we had the committee of the whole maybe about a year ago to discuss similar issues, we talked a little bit about trying to come up with some root causes here. So you've got some analysis that shows you this is happening. Have you done analysis to find out why, what's causing it? If we add members, it looks like a major shift in strategy or a tactic. Have you looked at what that, if you just said it yourself, we're just hitting a symptom here. It seems to me treatment is a big component here, and if that's missing, is it really a viable strategy?
Well, I think it's a viable strategy to address what this community is dealing with. When I think about homelessness, and every expert that's smarter than me and has been dealing with this longer than me that I've had access to spend time speaking with, I say, hey, things that are outside my control. If we had incredibly robust and available, that we can get them in right now, AODA treatment, if we had the appropriate amount of mental health care available in our community to serve not just the unhoused population, because often people suffering from mental health issues that are housed, those are individuals that become unhoused. And if we had enough affordable housing. So 3 things we know from the study here, we're looking at 5,400 short we are of units of housing. So if those 3 things were solved nationwide or statewide, we probably wouldn't be having this conversation or seeing this need. And I don't think this body necessarily has the money or access to be able to solve all 3 of those things in an efficient manner. So what this is a proposal that says, how do we create an environment in Wausau that doesn't, through utilizing the police department, enforcing the laws, ordinances, and standards of our community, how do we make sure as those things are addressed, however slowly they're being addressed, that we don't lose the quality of life that Wausau residents have come to know and expect. And I'm just here telling you, I cannot do it with the staff that we have without some neighborhoods not having police services because we're reallocating those individuals elsewhere. I think 2 officers who each work full-time and are addressing this issue specifically, we will see a positive impact in our downtown, and will be more viable to be able to still exist in what we know as Wausau. When hopefully some of these issues that I think are root causes get addressed in our community and nationwide. But if you ask me to give you a timeline on when we're going to have super robust AODA and mental health resources here, if I gave you a number, you'd look at me and say, you're full of baloney, Chief.
Well, and
yeah,
that
go
leads
ahead.
to a bigger, maybe an overarching situation. It looks like this is a major shift in strategy, and maybe it's time we bring this back to a committee of the whole and try to figure out how we bring these NGOs. We've got the 3-legged stool, for lack of a better analogy, the city, the county, NGOs, and we've seen fairly little movement from the county. We do have the NGOs working with us. This is bigger, and I appreciate the police chief putting this cross on his back to bear. But when we brought on Tracy, one of the discussion points was, is this the right place for this service to be under the PD? And I think the answer was, well, hopefully not long-term, but it appears that it is going in that direction, and maybe we need to adjust our strategy as a city. What is our strategic plan, and what does that look like with all of our partners, and not just putting it on the police chief to carry the load here?
My concern would be, you will see, I will speak on a regular basis about what the needs of our community are to serve this population and how and try and keep people that are on the bubble out of homelessness. If we're going to wait for those solutions to exist, that ship will have left the dock, and getting it back there is going to be 10 times harder than it would be today. That's my assessment after dealing with this on a daily basis. And I often think to myself how wonderful it would be if, as police chief, I just got to run a police department and this wasn't an issue. I kind of feel like if that day comes, I can just sit back with my feet up because it will be so easy. We still run a police department, and Tracy functions rather autonomously. She's almost a department within a department. And the analogy or example I can give you is if you look at inspections, Bill Hebert runs inspections, but he works under Eric Lindman in the overall DPW engineering umbrella. That's the direction we're going here because, to be honest with you, there's not enough hours in the day to run the police department and make all sorts of decisions regarding this. I'm just looking at my staff we just got done with in-service, and I said, what do you guys want to talk about? In the hour I stand up in front of them, and the whole room is unanimous. We need to talk about the homeless issues and how it's impacting our staff, and nobody applies to work at the police department and says, when I say, why do you want to be an officer here? And they say, Chief, I just cannot wait to work with the unhoused population, said nobody ever yet while I'm sitting there. However, our staff are more than willing to do that work. They just need to know that the work that they're doing accomplishes something. And so we are behind the scenes establishing what does that look like and how do we use enforcement to get people into resources, to get access to them to move forward. And I need these officers to be able to do that. So regardless of these other components that I think cause homelessness, the majority of it, they still need to be able to keep our head above water in the meantime, but it doesn't mean we take our foot off the gas in regards to having this community have those resources.
Well, okay, and I think that, as we've been kind of stepping our way through this, we have kind of had this, I don't see it necessarily as a change in direction. We always, I think, have recognized that the solution is twofold. It's both help and enforcement. I don't think the enforcement has necessarily stopped. I think there's more of it to do. Way back to when that task force first formed, enforcement in public facilities, first and foremost parking ramps, is how we ended up with the task force in the first place. I mean, we have been trying to address behavior and conduct at the same time, and of course, back then when we were trying to address behavior and conduct, there were nowhere near enough services to even start, the answer back then was, well, if I can't be here, where do I go? There was nowhere. So, we have made some strides in creating that place, where people can go and get that help. I guess I do share a concern about watering down the quality of our existing services because we have overloaded those facilities to the point where, they can't keep up. And we constantly, every month, are getting turn-away data from Tracy, from those shelters. And so I think that is another concern. Lou?
Thank you, Madam Chair. Do you need a motion to move this
Well,
forward?
we have a couple of folks that would like to make public comment. I know that the
Okay.
new director of Community Outreach Task Force has asked to offer us a comment tonight. Vicki Harness, if you'd like to come up and offer a comment. Welcome.
Hi. My name's Vicki Harness, and I have been the Executive Director of the Community Outreach Task Force since the end of November. You probably all knew Sandy and Amanda were working and had life events that made them walk away. The rest of us kind of just jumped in and kept the bus. We have the Marty bus on River Drive. We're still there on Wednesdays and Fridays from 11 to 2. Our numbers have increased as well exponentially just since November. We were feeding 23 to 29, 32 people a day when we were there, and now we're feeding anywhere from 43 to 59 people a day. And that's, they come, they eat, they hang out, they get clothes or underwear or socks or coats or shoes or boots and things like that from us at the bus. We are lucky that we don't have the disruptive behaviors at the bus while they're there. With new leadership in our position, we are expanding some of the things we do. We have a court program we've just started where we're going to make sure our clients are getting to court so that they aren't missing hearings and getting warrants for their arrest and whatever, so that we can help them navigate their going through the court process. We have had volunteers take people to the hospital. We've had volunteers taking people to dental appointments or to emergency dental care. We're further going to start in the next couple weeks a cleanup program where we'll have our clients going to the places where they loiter during the times that they're not at the bus to help clean up the areas where they've, and we're hoping that this will help. The other thing we want to try to do is a locker program where we'll have a space that they can call their own, where they can store their belongings. So hopefully then there'll be a less stuff left around in the parks and other areas. So I don't know about the need for officers. I'm sure that they're out there and they need them. The chief does a great job with what he's been doing. So I just wanted to let you know that we're here and we're trying to work with the population as well. And we would like to end homelessness too. I think part of the problem is right now is that because the places are all full, that people don't have a place to go, and they just really need a place to go.
Sure.
So,
Thank you for those comments. I think it's helpful to know that those services are expanding in different directions. You know, I think that there is such a need for volunteer transport and, even a cleanup program and a place for people to keep their things. I also think that the one blessing we've had this year is a mild winter. If that snaps back to normal next year, we could really have some crisis situations. So, we've had minimal activation of community on call this year, but next year, with the population we have, that could be a weekly occurrence. We do need to kind of get ahead of it. So thank you for those comments, though. And additional comment, I think Alder Killian wants to make a comment. Come on out.
Thank you, Madam Chair. Yes, my understanding of one reason that this had not arrived at HR, might have even been pulled in a way, was because as a city, it's really up to the policy body to deliberate on and create policy, and that includes strategy. Like, what's the city's strategy and approach overall to matters of the unhoused? And yes, we've kind of dealt with this in an ad hoc fashion when things come up as needed, but I would say that we don't have an overall approach and strategy. And yes, something like a committee of the whole would be worthwhile to come up with such things so that the police department, with an appropriate amount of input, can then carry out city policy as the policy-making bodies see fit. I think as was mentioned, I have appreciation and respect for what the police department has done, because essentially, absent of more appropriate measures, they've had to carry a lot of weight on this issue. But make no mistake, we do not want to turn the police department into a social engineering department. And this is a transition in strategy. The public should know that this is a marked, dramatic shift when we say, let's be very clear. It's not just making sure that people in town have maximum access to resources. What we're being told is, in that same vein, then we will deport those very poor individuals who are not from town, who cannot prove they're from here, back to their city of origin. That is not consistent with our community values, and there'd be a large percentage of Wausonians across the political spectrum who would not have that. It's not who we are as a city. And if we have the funds to hire 2 police officers, then let's use those funds, because this isn't a criminal problem. This is an economic, social, and medical issue. We should be putting those into more outreach and social services personnel. And we're not just focusing on, as it was said, a singular issue here. I think we're focusing on a singular socioeconomic segment. Would we do this with the more affluent? Would we be standing here saying, let's get 2 police officers to monitor, the rich in Riverview and the DUIs there? No, we have laws on the books, and therefore everybody. And I think Alder Hankey had a very good question with the last item, like, did you talk to the county and what are they doing? Apparently not a lot on these things. Alder Denny mentioned it with treatment. Before we take the profound and unappealing and unfortunate step of starting to deport the poorest people in town if they can't prove they're from here, why don't we put some pressure on the county to satisfy the role they're supposed to be fulfilling? And I think it's not just a city challenge. It's a challenge that they're not stepping up to the plate. So respectfully, those are my comments, and I hope the committee tonight does not approve these officers, and we can deliberate and discuss more what would be a more community-focused way of dealing with this, and I think a committee of the whole would be an appropriate setting for that. Thank you.
Thank you for those comments. I think that, I sense in the presentation, though, there is some measure of expediency that's necessary, both in terms of hiring the proper candidates, if we're going to do it, and the sourcing of funding, if there is some to be had from the private sector. So, a committee of the whole is perfect for discussion of a larger scale issue, but what happens is the committee of the whole cannot make any final decisions. All it can do is make referrals to committees. So what we would find ourselves doing is, if as a committee of the whole we wanted to know more about this in terms of whether it can happen or how it gets paid for, we'd end up with a referral to these exact same places. So as public health and safety, we address all things public health, or all things unhoused population on a monthly basis. We continue to get those reports, and when a report comes in like this, I think the ask of us is, conceptually, do we support this type of mechanism? Now, I didn't hear anybody say anything about deporting people that aren't from Wausau to their community of origin. I would say that, that is certainly not the goal here. The goal is and I've said this before, a 2-pronged approach. You have to uphold the regulations and ordinances you have, but at the same time, you have to get people help, and adequate help, who are willing to avail themselves of the help. I mean, that has been, the mantra that Tracy's been trying to follow here since she began. And so I think that we run the risk of mitigating everyone's effectiveness in what we're trying to do if we don't address an issue when someone brings one to us. The next logical step, because this would have 3 committee stops, it would have this, much like hiring 12 firefighters. It would start here, it would move to HR, they could make their determinations, they could talk with the HR director, they could put together some cost figures, and then when it needs money, that recommendation could be made from HR to finance to either accept grant funding or find funds. And then ultimately, the action of all of those things ends up on the council floor, and the council still owns that decision. So, I think that for us to kick this can down the road another month, and then we don't take any action, and then we expect a committee process to unfold, which is going to be, I think, where we end up in the same place. I think that we are putting ourselves further behind the 8 ball with inaction. I mean, I guess, what do you, Chad?
Thank you. Just some numbers I've noticed. I mean, when we first started tracking Tracy's numbers, the jail number was 0 for, I think, a year and a half or a year. And I have noticed in the last 3-4 months that there has been numbers on the jail number now. I guess another question or thought would be, has this gone to the task force, or are they aware of this? Just another thought on a place it could go.
That task force has a meeting coming up within the next couple weeks, but I think it's been actually talking about this all along. The influx has been widely discussed there, all of them, because there's representatives from all of the various agencies, provider agencies. I think all of them recognize an uptick. We have flat out asked in that task force, there's a rep from NCHC's director sits on that task force and has been very clear about the fact that they have not been issued any mandate from county management, either the board or the administration, to pursue services that are outside the scope of what they're already doing. So it doesn't sound to me like help is coming from either the county board, or NCHC anytime soon that is going to change this landscape for us. There is a perception within that body that this is largely an urban problem. And, I don't know that that's changing anytime soon. So, if there are, if it is possible for us to source some partner funding on this and to pilot a program where we can then gauge its effectiveness, over, say, a year and determine, do we want to continue or not? Have we moved the needle? I think that it behooves us to look into that, because that then keeps our taxpayers from going it alone in funding all of these things. So, I guess, it would be logical for us to make a recommendation to HR to consider this program. I mean, obviously, they can make whatever decision they choose, but the HR chair is here. I guess, Becky, would you be willing to have this discussion in your committee going forward?
Yes, we can have the discussion, certainly. We have one more meeting, I think.
Okay.
Beginning of April.
Okay. Sounds good. And we have a couple finance meetings too, so depending on the outcome, I mean, we certainly, it's not that we're going to fast track it, but I really feel like we need to keep progress moving. Lou?
Madam Chair, I think, I don't think we need to ignore this. I think we really should move this forward. But that being said, too, I think we need to possibly also somehow coordinate a meeting, or possibly with the committee of the whole, and get whoever we need to from the county in these chambers, and have them tell us why they're not helping us out, telling us why they're turning their backs on this problem in this community.
Yeah.
And perhaps in the meantime, as we go forward, some other options might pop out of that.
For sure. I think that with the new council coming on in April, so that everyone's up to speed, it would be very valuable to have a meeting like that, just to catch everyone up on like where we've been with all of this, because
And
we've been
who-
working on this for 4 years.
Would we perhaps have the clerk's office consolidate this meeting then between, how would you go about getting county officials and the county officials and the city council in these chambers to discuss?
Well, I think it would be difficult to have a joint meeting of both bodies. I think that, often you can bring the administrator in. We've done that before for our committee of the whole. Obviously, he is taking direction from that board. I think it would maybe be easier for our committee, then all of this, we're at the cusp of an election. So I think once we get into the next term, because we may have different seats at those tables as well, it would maybe be easier for our committee to have a joint session with their Health and Human Services Committee, but I don't think a meeting of our council and their board in total is as feasible. There's just, that's an awful lot of people to try to herd together to have a pointed discussion. And, we don't know what level of information or understanding they even have of this. There are a couple of county board members that sit on the task force, both of whom have been advocating routinely for things that underpin this cause. So, I don't know that they've been super successful, but they've been trying.
It's just like the SISM committee too. We spend all this money for license plates, and we see none of that money coming back to the city.
Yeah, like wheel tax?
For wheel tax, yeah.
Agree. Chad?
I guess how do we, I think encouraging like community outreach groups and maybe even the chief of police to go to county board meetings and have public comment before the meetings. I mean, I see that as another way to get this in front of them. I mean, it feels like everyone comes to these meetings to talk to us. Go to the county board meetings and tell everyone there what these issues are. Like, we're trying to carry a lot here by ourselves, but I think that would be a good recommendation to a lot of the organizations out there. Start going to these county board meetings and talking during public comment. Not sure if that's being done or not, but I don't think it is. Thank you.
So just to address that a little bit, like I'm agendized as a speaker, my understanding is early April with their Health and Human Services Committee. This is the topic to be speaking of. Outside of a meeting, I communicate regularly with the county administrator. But I agree with you and for two reasons. One, this gets a lot easier to handle the more partners we have, especially the county as a partner. And also through the lens of the residents of Wausau have been subsidizing outlying communities in regards to, homeless services. Catholic Charities is funded by the city of Wausau, but I regularly say, where do you think outlying police officers take when you find a homeless person camping in a park in one of our neighboring communities? Where do you think they take them? Like they take them to the CPC and they drop them off, and that's communities within Marathon County, but yet they're not partners in funding or creating resources in their own communities. They're very satisfied to have them here. I just don't know what the sustainability is. And secondly, within the potential for you all to have a cow, I think that's totally appropriate. I don't want to wait to make decisions on this until such time comes, but there will be very challenging issues that I will agree from this standpoint with Alder Killian that there is policy and direction and a point of view on this that is appropriate to come from the elected representatives of us here. And some of those challenges will come in the form of funding. What does the future commitment of this city to be funding some of these resources look like, if at all? What resources do we want in this community? How do we get those? How do we partner with the other service providers here to make sure we're all on the same page? I think those are issues that a cow and some perspective for myself that would benefit me to know the elected body of the City Council of Wausau has given me the direction that this, and then I'll look at it, well, how does the police department fit into that? But that gives Ms. Rieger direction in what to do. Lisa gives you and I direction on what to do on our task force and what is the City of Wausau's position when we meet. There are many things like that that are going to be hard decisions. They might not even be popular decisions, but that need to be fleshed out and debated, and that is the role of the council. I feel like that's something that needs to happen.
That does make a lot of sense. I mean, especially since we're coming to a changeover in April, at the end of April, to figure out, philosophically what stance that future council wants to take. I know all these things that we had invested ARPA money in to stand up, especially sheltering. We funded that for 2 years to get it going with a directive to the nonprofits that they then start to find replacement funding so that those efforts are not, dependent on taxpayer funding. ARPA dollars were one-time dollars. And so when that fund source runs out for us, it was not our goal to continue those programs as levy-dependent programs. So, hopefully those agencies, I believe they are looking for alternative funding and fundraising, they should be doing that in parallel while they're operating right now. So, I guess that said, I guess just to round this out and, let our different committees view these things through different lens. Is there a motion from within this committee to refer this item to the HR committee to consider this program?
Can I make one more comment?
Sure, go ahead.
I think we just demonstrated the chief is sounding the alarm. Vicki Harness is confirming we've got an exponential growth in this department. We've determined we don't know what the county's doing, or we know what they're doing, and it's not very much. But I think we've seen in recent past where we've been able to convene a committee of the whole and rapid order if it's an emergency, if it's something we need to do. So I we should not take that off the table and just on the basis of expediency. If it's something we need to do, I think we should do it. We can get the county at whatever level we can involved. We just came up with some ideas here about potentially speaking more directly to the county. I think those need to be on the table before we take a strategy isolated to the PD without the overall. And I'm not necessarily against this, but we have to look at what the overall strategy is. And I think Alder Killian talked to that. We've heard it numerous times. We can't fight this in isolation.
Right.
So I think we need to elevate this to a committee of the whole and make more noise rather than try to push the rope uphill.
Well, agreed. I think that you can make all the, we've been making noise. We've been making noise for a number of years already, and I think it's become, even through public media reports, it has become obvious that we are looking for a different level of support from our partners at the county, although I will say that the way to solicit cooperation from them very seldom is to burn it down and, malign them in public in the media. So, I think that if the chief is meeting with their Health and Human Services Committee and he's having some productive discussion about this situation, letting that conversation happen, and if we wanted to convene or see if we could get their committee chair, they have a committee that's similar to ours, if they wanted to meet in joint session at the beginning of the next term, I think that's important. But, I think that, for us to, sit at council and complain that they're doing absolutely nothing and they're not willing to, and that they're largely tuned out on the issue is not helping things. That's kind of how the conversation went at the council meeting the last time we talked about CW Solutions. So, I think that before we just burn it down and destroy the relationship, I think that we should try some proactive meetings with them, and their comparable folks. That doesn't mean, though, that we can't continue to have our internal discussions about what we believe the needs of the department are, because that isn't going away. Regardless of whether or not there's multiple players in the funding stream, the situation that we have playing out on a daily basis isn't leaving us, right? That's where I feel like we need to advance the discussion to HR and let that committee start a discussion. And in the meantime, if the chief then reveals or learns of funding partners or funding mechanisms, I think that we would certainly like to know about that in finance. So, the council meeting in a committee of the whole really is the council just acting as a committee, but it can't finalize anything and it can't spend any money. All it does is make referrals. And the process for that is that has to either be called for by the mayor, the council president, or two alders in writing. So that is yet another process that has to take flight if you want to go that route. We don't prescribe that here in this committee. This committee just, all we've been asked to do is decide, do we support further research of this process or not? And do we want to move that discussion forward to HR, which the HR chair has said she's willing to talk about it. So, Lou.
I don't think we can stand idly by either way. We can't wait on something that might never come. Even if we do have to go this our own, we have to go at our own, but that being said, let's not also, let's keep the pressure on where it needs to be on and at the county level. But, so I'm going to make the motion to move this on to the HR committee.
Okay, we have a motion to forward this program to HR for review. Is there a second?
I'll second it. I'd like to amend it. That
Sure.
We include the sunset date of December 2025 for these positions. Was that correct?
Yeah, I think,
I just want that as part of the motion, just so that HR knows where we're coming from.
right, the current funding model that I'm hoping to be able to present to Finance Committee would have a sunset of that funding of, the agreement would be to fund it through the end of 2025, so we can't have positions that aren't funded. But prior to that, we will have discussions with the council through the budget process and through working with those funding sources to measure the success of it, to determine whether it's worthwhile to even have a discussion moving forward. But the funding that would be approved in this approval process going through the committees would be to only have it funded through the end of 2025, if that makes sense.
So,
It does.
so maybe it's appropriate then with that motion to.
I'm okay with that amendment.
Yep,
in my
so
original
the
motion.
amendment then would set a sunset date on the program, absent its renewal by the council of 12/31 of 2025. And I think it would also be appropriate to ask that we, as a committee, gauge its effectiveness well in advance of that. So perhaps at, one of our meetings in September of 2025, a report could be brought about the results, what measured results we have from these efforts, whether we're going forward, backwards, or standing still. So,
I think it's important just to be crystal clear that success in this area through my lens is not having a need for this team indefinitely.
Right.
Or any growth. So if we can work effectively enough that they're no longer necessary, that's what success is going to look like. So very rarely have I come here with any expansion of the police or any of our teams with a belief that we can work ourselves out of a job, at least in this lens and what we're working for, but that's ultimately the goal.
okay. I think that's what we would all like to see. So we've got a motion from Lou, we've got a second from Chad with an amendment. We should vote on the amendment first, which is to set a sunset date of 12/31/2025, and recognize that this committee then should conduct a review of the effectiveness of the program at its September 2025 meeting. Do we have a second for the amendment? Second by Larson. Okay, further discussion on the amendment, which is the sunset date and the analysis. Okay, we'll vote on the amendment first. Members in favor of the amendment signify by saying aye.
Aye.
Aye, opposed? None are opposed, so the amendment is approved. So then we'll go back to the original motion, which is to refer this program to HR, to consider the creation of the positions as amended on the floor. And we had a motion and a second for that. Further discussion on that? If not, members in favor signify by saying aye.
Aye.
Aye, opposed?
No.
Okay, we'll record one opposed. So that will then proceed to HR on a vote of 4-1. So that takes care of that item. Let's see here. Next item on our agenda is number 6, discussion and possible action on committee duties and responsibilities. And so a number of us have experienced this in our other committees. The last, I would say, month or two, the city attorney's office has been busily analyzing the duties of our committees and looking at the descriptions that are posted to our website for the scope of operation of our committees, and then, trying to, I guess, more clearly articulate the duties thereof. This committee, I think, is probably her hardest one, so we'll bring up the city attorney. She's been poring over all of these documents and finding a list of things that we do and things that we don't do and things that we haven't done for a long time that we probably don't care to ever do. So we'll turn it over to Ann.
Thank you, Madam Chair. Actually, I think this is the easiest committee because at the end of the day, you are doing everything according to the 9 chapters I found the name of this committee in the ordinances. What was off appeared to be the description on the website, and that seemed to be exactly in tandem with the 1966 description of the Judiciary and Personal Property Committee. So that description made sense to me when I realized it originated from the legislation and Personal Property Committee. So my recommendation is just to rewrite the summary of your duties and responsibilities from the code references to put on the city website, unless there's anything in the ordinances you want to change.
No, I think when I looked at it, as we've been going to add things, we've added things like quadricycles and dog hearings and licensing and revocation processes and fire pits and sidewalk cafes. As we've been writing that, I think we've been really good about getting it codified, so.
Yeah.
You know, and a number of those things they've had to prosecute, and we've actually had quasi-judicial hearings about them, so we've been able to stay timely.
Absolutely. I think
Timely
you've
in
done
our.
everything in the
in our work.
code.
At some point,
Yeah.
we've seen it all.
Yep.
On this list. I guess, committee, how are you guys feeling about this? I think we are doing the duty that is aligned with what we do. Should we be tweaking that online description a little bit? I mean, to make it
Absolutely.
more accurate, but,
Just so it's not so misleading to the public. I mean, it talks about legislation and finding housing stock for the city and everything from legislation to economic development to police and fire commission stuff. I mean, it had everything in there.
Yeah.
But I think that's because it came from a long ago, description when it had a completely different committee name.
yeah. I mean, this committee has, in terms of things that it has to manage, it's got a heavy lift every month because we oversee so many things. And then afford legal due process to a lot of things in terms of revocations or suspensions and things. But we're certainly equipped to do that. But, I think if we would true up the online description too, so that, that new members trying to figure out what committees they want to serve on, get an accurate depiction of what this is all about, and, I don't know that we ever have, even though it exists on the website, that we would be inventorying housing stock and, we have never,
Right.
the only part of housing that we really have worked with in here was code violation enforcement,
Right.
with rent abatement and, that housing code enforcement task force started out of here a number of years ago when we started to look at things like landlord licensing and things like that. I mean, that really came from here, but as far as inventorying
That's right.
housing stock and fundraising for it and that type of stuff, we've never engaged in any of that.
So my goal would be to rewrite that. Finance will meet, last probably on the 9th, but also on March 26th. So I'm going to finish with finance on the 26th. And then by the 9th, rewrite some of the descriptions. You'll see probably on the 26th, the ordinance from SISM. Those types of things, try to get those done before the end of this term so that at the new term full council can adopt, when they adopt their rules, the descriptions of the various committees.
One of the duties that I saw that I found interesting in here, as I was reading along, was one that says, make recommendations for the purchase of vehicles and equipment for the police and fire departments.
Right, that's on the website.
And typically, we've been, we've really have kind of pushed that whole thing to motor pool and to CIP, because those things are expensive, and that's how they get funded, and then they become really an arm of finance. But finance doesn't rank or score motor pool. It doesn't, we don't look at things like the number of vehicles, we don't look at upfitting, we don't look at the function of the equipment. We just really, the department knows what its needs are, they work with motor pool, and then they fund them cyclically. This committee has really never put its toe in the water with
But
equipment
I think
needs.
that came from when the committee was called public property.
Yeah.
Which is very different than public health and safety.
Right.
So it's all kind of evolved over time.
I do feel like between CIP, motor pool, and the budget process, that really has been taken care of well. As far as vetting the stuff, I guess, how do you guys feel about that?
I guess, if you want my opinion, I don't think it belongs here.
I don't either, really. It doesn't feel like it's,
It's not a public health and safety matter purchasing
Right.
fire equipment,
well, and
police cars.
historically, we've never, the one thing that we've been consistent with in public health and safety is we don't spend money here. We can support a concept, but then like with HR, they create the position and finance pays the bill, but we just really don't approve the spending part. We're more up here on all of that. So, anything else that anyone else noted in here that you thought needed adjustment? If Anne rewrites the description to get the website current, are you guys content with what we see here? This took a lot of research for her, but I'm glad she found out that we were largely doing the exact job we're supposed to do. So, and that we appear in the code more than any other. So that's helpful. And that's something we can agree on by consensus. Go ahead, Chad.
That was my question.
I don't think we have to vote on it.
All right.
We're not
Very
making
good.
substantive changes, so I don't
Right.
think we have to vote on that action.
All right.
All right, so thank you for
Thank you
that
very
research,
much.
Ann. I know it's been a lot of work, so.
Thank you.
With that, we have the tavern activities report for the month of, is it January or February? No, we had the wrong minutes, so, I'm going to go with February. Anything notable on the report that you want to ask the chief about? Or anything that you want to highlight for us, chief, and that's in the reports?
I think it was a pretty normal, we didn't issue normal month, maybe a little bit low. We didn't issue any demerit points to any taverns.
Okay, it's good to have that. Okay. Is that in the report? Yep, so, okay, yep, we were going to ask about that. So in the report, it had mentioned that 11 extra patrols were conducted during the month of February and that the bar was closed except for February 15th when an officer noted the establishment was open. They had been keeping an eye on that establishment to make sure that it was open and using the license. The liquor license review subcommittee, though, at its last meeting, heard from a new owner that's interested in buying that establishment. I believe it's the same owner that owns Hones Huddle along Grand Avenue. ahead.
Where is this? Yeah, which one are we talking about?
The Cruise
Sorry.
Inn.
Cruise Inn.
Inn.
Okay, thank
Cruise
you.
Inn 1724 Merrill Avenue.
Okay, thanks.
Tegan had just mentioned that noted in the report was the extra patrols that we had asked for to kind of keep an eye on that and make sure that it was open. But now knowing that it's changing hands, the task force was made aware that there will be a new owner there, and that they're preparing to, get open and do different things. Lou?
Go ahead and finish your next. Something else.
That was it. That was the one that I noted there.
What about with the Domino Bar? I see nothing on here. Is that, what's going on
I
there?
think that was one that they had kind of looked at too, with some patrol was going to kind of watch to make sure that one was staying open, that it's had some extended closure.
Yeah, and they had contacted the clerk's office that they had limited hours on the weekends. That's the last we had heard.
But that opening on the weekend was enough consecutive open days to comply?
It
So
was
they're
a
not-
regular schedule.
So they're not, okay, so they're not in,
So can we have an officer swing by there to?
keep track of the weekend and make
to
sure
keep
it's really
track of
open?
that? Just to swing by there to make sure the lights are on?
I nod my head, but I don't do staffing.
Sure, we can. I think for a limited period of time, that would be appropriate. It's tough to, here's where the rub comes. We're looking to make sure they're open, generally speaking, through our busiest hours of the day.
Right.
And if we miss, then someone's got to say, well, we were open on that day, and we have no way to prove or disprove that. So we can put that on the list and try and accomplish that for the
Okay.
next month if.
Okay, thank you.
I think it's just something that's maybe important. I mean, even if the sector officer just keeps an eye over that direction and makes sure that periodically they're open and functioning is important. So, but yeah, recently the task force heard from Cruise Inn 1724 and Campus Pub, both of which are pending new owners. So we'll hopefully see some different and maybe some more activities happening in those two places that have been pretty dark recently. So anything else on the report that you want to ask the chief about?
I just wanted to say too that in our liquor review meeting that the Cruise Inn was also, didn't they talk about having a food truck there every once in a while too?
They did, and then a selection, I think that was the one that wanted to have a selection of different pizzas brought in from different
Right.
places too. Not the loud live music type stuff that's been a problem in the neighborhood before, so we were excited to hear that part. And just looking for maybe a little lower key type of operation. So in a neighborhood surrounded by houses, low key is kind of what it's about, so I'm good with that part. I was happy to hear that. Anything else on that item? If not, we'll place the tavern report on file. And then our community outreach report is the last report for the evening. So we'll bring up Tracy to talk with us about her experiences. Welcome back.
Hi, thank you. So tonight I just want to start by saying thank you to everybody who has expressed their concerns and comments about the unhoused population. It is growing, and if we don't do something, like Chief Barnes said, soon, it is expected that our population would grow in 5 years, double what it is today. So I can't even imagine what that price tag would look like in 5 years from now. Speaking about the shelter numbers this month, I mean, they're real consistent with last month, if I'm being really honest. Where we see the change, and I'm sure you've all saw this number and thought, oh my goodness, is really the turnaway rate. If you notice that Catholic Charities for the month of February turned away 117 people. That's the highest turnaway rate that they have had. And so I think right there is where we're seeing we have a ton of people coming into the community and we don't have the resources to shelter them all. And so we have identified that, and a couple of us employees with the city have requested a meeting with Catholic Charities to just kind of talk through some of that and see if there's ways that we can decrease that number of turnaways. You know, what can we do to get creative with that? So I just wanted to report that here to let you know that we're not just reporting the number and ignoring. We're trying to figure out what we can do to make that number decrease in the months to come. As far as my activity this month, I have met with 7 individuals just to talk about resources. I housed 2 individuals. So that's all fine and dandy, but I can tell you that part of our population growth is in part due to some of those individuals that I have housed coming back into homelessness. And next month's report will identify some of those struggles. And so I look forward to talking through that with all of you next month. I will tell you that I did meet with Aspirus Hospital per their request, the emergency room department, and what they're seeing too is they're seeing an influx of unhoused individuals coming through the emergency room from different communities. Because of the level of care that Aspirus is able to provide, you know, we're getting clients from Stevens Point, they're getting clients, cardiac clients right now from Eau Claire because they've had a hospital closed down there. So this influx of individuals is, yes, they're coming for services, but they're coming for medical services too. And when they're getting discharged into homelessness here in our community. So I've met with the staff at Aspirus. I think we're going to be planning another meeting so I can meet with the emergency room staff and so we can talk through and try to coordinate services prior to them discharging, if possible. I've provided my homeless outreach resource brochure that they didn't have. They actually wanted to create one, and I said, you don't need to do that. We already have one. So again, you know, the importance of collaboration amongst the members of this community is really, really important, and I've worked really hard to try to make those connections. Because I think that we can't move forward as a community if we don't have all of the players in the same sandbox playing well together. So that's my goal. The other group of individuals that I've connected with is our clergy. So we have some of our religious leaders who are interested in meeting with me over the summer to talk about how they can come together as churches to help support the work that's being done, because they're also seeing an influx of calls into their churches for rental assistance and other services related to those who are on the brink of homelessness or are homeless. So I just wanted to highlight those things here, but I really just wanted to say thank you again to everybody who's working on this issue because it is complex. And Chief Barnes, I really do respect where the police department is with this, and I respect the support that I get from them.
Okay.
Any questions?
Sure. Becky?
In talking about people coming from other communities to Aspirus, how do they get here? Is it VAO, MTM?
I would say all of the above. I know for a fact that there was a gentleman from Stevens Point that was brought here by ambulance.
Because VAO, I mean, is a medical assistance
Correct.
transport. I don't understand why they would be, why they are not getting VAO back to their community. That is the hospital's responsibility then to discharge them to the streets. So there always is a resource, and I hope that, you know, make sure that they are, that VAO should have been scheduled, you know, by their social work at the hospital, and they know how to do that.
Right.
So, I mean, we just can't have people discharged from Eau Claire to Wausau out in our streets. They have to be transported back, and there is a resource for that.
Right, and I think, so that's part of the conversation I'd like to have with them is, you know, how can we mitigate this problem becoming bigger in our own community when we didn't bring them here? And to Mr. Killian's point, it's not a matter of deportation, but a matter of getting people back to where they actually want to go, so.
Well, I know you mentioned in one of your success stories early on that you were able to reconnect someone who had run away from home with a parent who desperately wanted that person back.
Yeah.
And, that's a success story. That's not a matter of, being cruel to someone who happened to end up in Wausau.
Sure.
Sometimes there are places that people would like to return, but they don't have the means. So, I think that, we can't underestimate the value of those reconnections as well. I think that, it's easy sometimes to, vilify an effort to get someone home as something other than that, but that's not what it is all the time, so.
Right. And I also think that, Chief Kopp, to your program, I obviously fully support that, but I also think that as I'm talking with unhoused in our community and see the struggles that they have, medically, I just see that that's such a positive thing to bring to this community, because there's lots of reasons why they don't go to the hospital. There's lots of reasons they don't go to the doctor. So to remove that barrier for them, I think is going to be fantastic. And I do think that we're going to see some really positive outcomes with that program.
That's inspiring. I am excited about that part,
Yeah.
too. Anybody have questions for Tracy about her work or about the report? If not, we'll keep plugging away. Thank you for everything you do.
You bet.
We appreciate it. So with that, that's the last item on our agenda for tonight. I'll take a motion to adjourn. Motion from Henke, is there a second? Second from Larson. Members in favor signify by saying aye.
Aye.
Aye, opposed? No one's ever opposed. We'll stand adjourned then. Thanks, everyone.